My name is Serene Carruthers, and I'm a therapist and the manager of McDonald Center, Sharp's substance use treatment hospital. During these difficult times, you may have noticed that you or a loved one are turning to alcohol or other drugs to help cope. But how can you tell if there's cause for concern? The 4 C's of addiction may help signify if you or a loved one needs more support. The first C is cravings. Drug and alcohol cravings mimic physical needs like hunger or thirst. To someone experiencing a drug or alcohol problem, this substance becomes as vital as food and water. Cravings can become so intense that they cause restlessness, insomnia, or a lack of appetite. They may become anxious, agitated, and unable to think of anything else when cravings aren't satisfied. Next is compulsion. Compulsion means someone has an irresistible urge or an uncontrollable desire to perform a specific action. Someone with an addiction is overpowered by the urge to find and use drugs. This type of behavior is described as compulsive drug seeking and can result in anxiety if the habit is not met that affects all other behaviors. The next is control. Oftentimes, in the early stages of addiction, an individual will try to cut down or eliminate the behavior. This is impossible when the lack of control stage of addiction is reached. When a person is unable to exercise any restraint when it comes to their drug or alcohol using habits, a severe addiction has set in and treatment is essential. The final C is consequences. This is when someone with addiction continues substance use despite negative consequences. Consequences can harm a person's mental, physical, emotional, financial, social, and professional health. The impact of addiction on relationships can be downright devastating. Carrying on with substance use in spite of knowing the problematic consequences that it brings raises the concern that someone may have developed an addiction. Getting addiction support can be a tough decision, but there are options. McDonald Center offers both inpatient treatment and treatment outside of the hospital setting. Our programs help build a foundation for successful alcohol and opioid addiction recovery, including ongoing aftercare and family support services. You are not alone.